Now you all can see my slides.
Yes.
Okay, so I'll start now. I hope all of you all are here. Okay, so welcome back to this post lunch session of basics of oncology. I hope you all have had a nice lunch and I hope all of you all are awake and fresh. Yeah, so we'll start. So we in the morning in the first half we saw everything about cancer, classification of cancer, what goes wrong and then cancer arises. Then, what are the efficacy parameters with respect to cancer? What are the characteristics of cancer cells? What are the different types of treatment for treating cancer patients? So, we saw all that, right? So, basically, we will be focusing our discussion on chemotherapeutic drugs. People are still joining. Anyone is remaining still?
No, there is no.
Two people have
Yeah.
joined just now. Anyone else is remaining? There
No,
are
no.
only 6 people here.
We are share the screen, so you can continue.
Okay, fine. Yeah. So basically, what we are interested in learning about chemotherapy and the chemotherapeutic drugs, because all our drugs fall in that category, right? So basically, what is chemotherapy? It is any drug or combination of drugs used to treat cancer, right? So if you give one single drug to treat cancer or you give a combination of drugs, okay, so that is called as chemotherapy. A chemotherapy generally is given in two ways. One is systemically and one is loco-regionally. So what do you mean by systemically and loco-regionally? See, so what do you mean by systemic? So from the name itself, you can understand systemic means it goes to the entire body. So how is it given? Systemic chemotherapies are administered via oral or intravenous routes. They can be oral or through intravenous routes. When delivered orally, the drug is of course in the pill form. When it is delivered intravenously, then it is given through directly into a vein. In both the cases, the drug is metabolized and distributed widely throughout the body. So the drug gets metabolized and it gets distributed throughout the body. Therefore, the name given is systemic chemotherapy. Okay, so here you can see the oral form or injectable being given and it goes to all the places in the body. So that is called as systemic chemotherapy. Now, what is loco-regional chemotherapy? See, from the name itself, you can understand loco-regional means it is confined to the area where it has to be given only. So locoregional chemotherapies are administered. Oh God, who's joining now? Yeah. So locoregional therapies are administered directly into an organ or at the anatomic site. So where exactly it is required, where exactly the cancer is present, it will be given at that point or at that place itself. So it is called as locoregional. Some examples are intraperitoneal, into the abdomen, intrathecal, into the spine, and intraarterial into the artery. So it can be given in any of these three forms. They increase the concentration of the drug near the tumor. So what is the advantage of locoregional? The amount or the concentration of drug present in the tumor will be very, very high. Since it will be very high, therefore the kill rate will be more. Therefore, more number of cancer cells will get killed, right? And plus the side effects also, if you see, will be confined to that area and the side effects will not be systemic. So these are the advantages of the locoregional chemotherapy, right? So this is the difference between systemic and locoregional chemotherapy. Now, what is the goal of the chemotherapy? Chemotherapy goals to cure the patient, of course, to prolong patient survival and maintain quality of life. In some cases where the cure is not possible, so you have to give chemotherapy so that you can prolong the patient survival or give some time or life to the patient and also improve the quality of life of the patient. Generally, these cancer patients have a very bad quality of life because they are suffering by from one or the other symptoms, or else at least sometimes suffering from the side effects of the drug, not with respect to the disease, but with respect to the drug. So they face a lot of problems, right? So chemotherapy sometimes is given to cure the patient. Sometimes it is given to prolong the patient's survival and also to maintain or improve the quality of life of the patient. And lastly, to provide palliative care. So, what do you mean palliative care? See, when the patient's cure is not possible and the patient is terminally ill, nothing is working, no treatment is working. Okay, so then that time, what you do, what the doctors do, they don't give very harsh chemo or anything, but they give drugs or chemotherapy drugs in such a way that the patient is relieved of the symptoms. See, because in some of the terminally ill patients, like colorectal cancer, the patient will have a lot of diarrhea, nausea, vomiting, majorly diarrhea. So, some chemotherapy drugs are given in such a way that they don't face such side effects. Okay, and even if they have to face, then the frequency is less, so that they are able to stay peacefully without the signs and symptoms of the disease and go away peacefully. So that is palliative care. So you give a treatment to make the patient free from the symptoms and to at least live till the time the patient will survive in a peaceful manner. So that is palliative care. So what are chemotherapeutic drugs? The chemotherapy drugs are cytotoxic in nature. They kill cells usually by disrupting essential normal functions. Just one second. Just one second. Hello. Yeah, sorry, we'll continue. So, what are chemotherapeutic drugs? Chemotherapeutic drugs are cytotoxic because they kill the toxic cells and they also produce toxicity. They kill cells usually by disrupting uh, yeah. They kill cells usually by disrupting essential normal functions, example DNA synthesis of proliferating cells. See, one thing you need to understand, these chemotherapeutic drugs are drugs which are used to kill the cancer cells, right? So, and most of the drugs, 80 to 90% of the chemotherapy drugs, they act on the DNA. Either they disrupt the DNA synthesis, inhibit the DNA synthesis, or they cause damage to the DNA, or they cause cross linkages to the DNA, or even uh, they may damage the DNA. And the simple thing is 80 to 90% of these drugs are going to act on the DNA itself, either on the DNA synthesis level or at the DNA level. They will cause breaks, cause cross linkages, such things. But most of the activities are on the DNA. Why this is so? Because DNA synthesis is one of the most important thing for cell division. So first DNA synthesis, we saw in the morning, first DNA synthesis takes place and only then the cell mitosis takes place, right? So it's a very, very important aspect. So also, there are certain enzymes, there are certain proteins which are required for DNA synthesis. These chemo drugs can also act on these proteins and also on these enzymes which are actually helping in the DNA synthesis. They can inhibit them or they can cause some damage or they may not allow them to help in the DNA synthesis procedure. So basically, most of the drugs are going to act on the DNA itself. Very few will act here and there. Because cancer cells proliferate more rapidly than normal cells, cancer cells are more susceptible to chemotherapy. Now, why do we have only chemotherapy drugs being given for treating cancer? And why not the other drugs? And why not these drugs are given for treating the other diseases? What is the difference? See, basically, you know what is the principle behind the cancer cells? Cancer cells we know are of course abnormal, but they are very, very fast multiplying. They multiply very fast, right? Which is not the case with the other cells, except for few. The cells which are in the bone marrow, your hair cells, your mucus lining, all these actually multiply very fast, but the other cells proliferate at a normal pace, right? Now, chemotherapy drugs have a property. They will act only on the fast multiplying cells. They will act only on the cells which are multiplying very fast and not on the normal cells. So, because of which, since they act only on the cells which are going to multiply very fast, they become useful for killing the cancer cells because cancer cells are proliferating very fast, they are multiplying very fast, and chemotherapy drugs will attack the cells which are multiplying very fast. Therefore, more number of cancer cells are getting damaged with chemotherapeutic drugs. Very few normal cells will be affected because actually they act only on the cells which are fast multiplying. Very few cells which are normal but they multiply very fast, they will act. That's why you see most of the drugs are acting on the tumor, but they are also acting on the normal cells which multiply very fast, like your hairs. Why do people lose hairs after chemotherapy? Because cancer cells are multiplying fast. Likewise, these hair cells also multiply very fast. But the chemotherapy drugs cannot identify which is a cancer cell, which is a normal cell. They know these are fast multiplying cells, so they will damage the hair cells also. Because of which there is a lot of hair fall, that is alopecia. There's a lot of nausea, vomiting because the mucus lining is because it is covered by the mucus lining. The GI tract is covered by the mucus lining, and due to this, the mucus lining is affected, and the patients get GI disturbances and even nausea, vomiting like feeling. Okay, and the other place where you have fast multiplying cells is this, sorry, bone marrow, right? Now, bone marrow is a soft spongy tissue which is present inside the long bones like your thigh bone, your femur bone. So inside such bones, you have the bone marrow. And inside the bone marrow, the cell multiplication of RBCs, WBCs, and platelets take place. So all the blood cells get multiplied in the bone marrow. And since they multiply in the bone marrow, their multiplication is faster because they are continuously required, and RBC, WBC, and platelets grow and multiply very fast. Because of this, the drugs will go and attack the bone marrow also because they have fast multiplying cells. Therefore, you have bone marrow depression or myelosuppression inside the bone marrow. That's why we see this side effect. And also patients can suffer from neutropenia. That means low neutrophil counts. Patients can have suffer from febrile neutropenia. Patients may have fever. Things like that, thrombocytopenia, and such things, of course, happen after taking chemotherapeutic drugs because the principle is they act on the fast multiplying cells. Nevertheless, normal cells are also damaged by chemotherapy but at a slower rate. As I've explained you in oncology, these adverse effects are called toxic effects or toxicity. In general pharma, we call it as adverse effects. In oncology, we call it as toxic effects. Toxic effects caused by chemotherapy tend to be systemic. Toxic effects caused by chemotherapy tend to be systemic. That means they can affect many parts of the body. If toxic effects are intolerable, chemotherapy drugs must be adjusted or chemotherapy must be discontinued. See, if toxic effects which are caused by these chemotherapy drugs are systemic, that means they are affecting all parts of the body. And generally, if the drug is given systemically, the toxic effect will also remain systemic. If toxic effects are intolerable, chemotherapy drugs must be adjusted. Supposing if a patient has got lot of side effects after taking these drugs, then the dose has to be adjusted. Either the dose is reduced, or the gap between two chemotherapy is increased, or sometimes if the toxicity is very high, then the dose is discontinued also, or sometimes they may even change the chemotherapy drug. So that is also possible. Patient eligibility for treatment. A patient's eligibility. Now, see, we have this. We have seen what are chemotherapeutic drugs, which are the two ways in which they are given, and also basically what chemotherapeutic drugs uh, do, and what is the principle behind chemotherapeutic drugs. So now, once we have understood all this, we have to actually decide which drug to give, which combination to give. And we also know the staging, we also know the grading of the patient. But there is one more aspect that we have to decide uh, for giving the treatment. A patient's eligibility of cancer treatment will depend on three factors: performance status. What do you mean by performance status? Is basically how the patient is performing in his day-to-day activities. For example, whether the patient is able to take his own bath, he's able to eat his own food, he's able to walk around. Okay, so and this performance status rated on the scale of 0 to 4 or 5 like that, and then the rating is given. If the patient is able to perform his activity, then he gets a higher rating. If the patient is not able to perform, then they get a lower rating. So it will also depend on patient's performance status. That means how the patient is in performing their day-to-day activities. Of course, patient's treatment will depend on the cancer type, which cancer the patient is suffering from, and also the cancer state. What is the state of the cancer, whether it is spread or not spread, etc., etc., right? So we saw about the principle of chemotherapeutic drugs. Now we have to understand the different types of chemotherapeutic drugs. They are broadly classified as alkylating agent, antitumor, antibiotics, antimetabolites, and natural products, and even miscellaneous agents. Now, alkylating agents. See, from the name itself, you can understand that these alkylating agents have got an alkyl group. Now, what are these alkyl groups? In some of the molecules, you have an alkyl group. Alkyl group is when you have these alkanes and alkenes, you remove one hydrogen atom or two hydrogen atoms, and that becomes an alkyl group. Like we have methane CH4, If you remove one hydrogen atom, it becomes CH3. That means the alkyl group is CH3. So these alkylating agents have one alkyl group in it. Now this alkyl group, since its valency is not fulfilled, one or two valencies are vacant, it can go and attach itself anywhere. Okay, so it goes and attaches itself in such a way that it can cause damage, and that is the basic principle of alkylating agents. Cytotoxic drugs produce DNA damage. They get converted in the body to active substances having alkyl groups. So they get converted in the body to active substances having alkyl group, or sometimes they themselves have the alkyl group. They alkali DNA bases like guanine. Abnormal base pairing resulting in DNA damage and cell death. See, because it is alkylating the DNA, that means it is attaching one of the bases like the guanine. And when it attaches itself, obviously a wrong group has attached itself to the guanine. Therefore, due to wrong base pairing, the DNA damage takes place. The DNA damages, the cell also dies. So this is a simple mode of action of alkylating agents. It's the alkylating group which play the major role. They can be further classified as nitrogen musters, alkyl sulfonates, nitrosoureas, and triazines because of the alkyl group present in it. We have cyclophosphamide, busulfan, bisphenol, triazine, dacarbazine we have, and even temozolomide, right? So these are the drugs that we have which are the alkylating agents. Antitumor antibiotics. They interfere with DNA. Yeah, they kill the cancer cells. They slow and stop the cancer cells from growing. Like bleomycin, doxorubicin, daunorubicin, and epirubicin. These are all the 4 drugs which come under antitumor antibiotics. What is the mechanism of action of antitumor antibiotics? They structurally resemble natural vitamins, purines, and pyrimidine bases. Yeah. So these purines, pyrimidines are present in the nucleus, which are useful, and vitamins are present naturally, which can be useful in the DNA synthesis procedure also. Okay, so these antimetabolites, they have a structure which is either similar to a natural vitamin or a purine or a pyrimidine. So how do they act? They inhibit important cell substances which help in the synthesis of DNA. Okay, they inhibit important cell substances which help in the synthesis of DNA. So there are, we have seen in the morning, there are various proteins and enzymes which are required for DNA synthesis. What only these antimetabolites do, they will inhibit these important substances which are helpful in the DNA synthesis. For example, methotrexate inhibits with folic acid synthesis. Folic acid is required for the synthesis of DNA base pair synthesis. Okay, so if folic acid is going to be inhibited by methotrexate, then obviously cancer cell will not be formed. Okay, so this is a simple mode of action of methotrexate. Okay, now these antimetabolites resemble either a purine or a pyrimidine base of the DNA, therefore gain entry into DNA strand and then damage the DNA by causing false substitution. See, these purines and pyrimidine are the bases of the DNA. When a DNA has to synthesize or duplicate itself, what happens? The DNA will first uncoil itself, then it will duplicate, and then it will go to 2 different cells. So that is the simple way in which DNA synthesis takes place. But what happens if these antimetabolites are given? If these antimetabolites are given, they, after getting metabolized in the body, their structure is similar to purine and pyrimidine. So after they are metabolized in the body, they go and attach themselves to the DNA which is undergoing DNA synthesis. Okay, if they go and attach there, so a wrong purine or a pyrimidine base has gone and attached. Instead of the right one, the wrong purine or pyrimidine base goes and attaches itself to the DNA because it resembles the purine and the pyrimidine. So DNA cannot make up whether it is a a real purine or pyrimidine or a misnomer. So these purine and pyrimidine bases, they resemble like a mRNA. When the DNA uncoils itself, yeah, then it has to duplicate. So what happens with the help of the mRNA, a new DNA strand is formed. So after two new DNA strands are formed, they will coil themselves and form two DNA, right? But here, instead of the mRNA coming up, a wrong purine or a pyrimidine base goes and attaches itself to the DNA. DNA cannot make out, so it feels it is a right purine and a pyrimidine base. It attaches, and this is called as false substitution or masking. Okay, a wrong purine or a pyrimidine base is going and attaching itself to the DNA, thinking that it is a right one. Okay, so that is called as DNA uh, masking or as false substitution. Some of the antimetabolites are classified as folic acid analogs like methotrexate, pyrimidine analogs like 5-FU gemcitabine, purine analogs like mercaptopurine. Okay, so there are various antimetabolites which are seen today, and we have methotrexate, 5-FU gemcitabine with us. Natural products. So apart from the alkylating agents, we have antimetabolites. We have the antimetabolites. We have the alkylating agents. Now we have the natural products. So these natural products are the ones which we get either from a plant or from some antibiotic or enzymes. Like you have Vinca alkaloids, they come from the Vinca class of trees. Okay, so there you have the drugs like vincristine, vinblastine, vinorelbine, and we have vincristine and vinorelbine with us. Taxanes also are a plant product. They come from the Asian yew tree. Okay, so you get paclitaxel, and some of the other taxanes are your docetaxel and gabapentin. Then you have epipodophylotoxins like etoposide. They are also plant products. Camptothecins are also plant products. You have topotecan, irinotecan. Then antitumor antibiotics like doxorubicin and bleomycin, and enzymes like L-asparaginase. So these are all coming under natural products, but they have some similar mode of action. They are either antimitotic agents. Now, what do you mean by antimitotic agents? See, when the cell divides and the cell mitosis phase, from one parent cell, two DNA strands are getting formed. So the entire genetic matter duplicates. The chromosomes go to two sides of the cells, but they attach to a centromere with the help of mitotic spindles. Okay, these are thread-like structures. So the genetic matter is attaching itself to the centromere, is getting pulled towards the centromere with the help of these mitotic spindles. So these mitotic spindles are required for the DNA, for the cell mitosis. But what happens? These plant products are, they inhibit the synthesis of mitotic spindles. So they don't allow the mitotic spindles to get formed, and due to which mitosis does not take place. And if mitosis does not take place from the parent cell, two daughter cells cannot be formed, and because of which the cell will also die, and further cell multiplication is of course not possible. Okay, so this causes DNA strand breaks. So one mode of action is, it is antimitotic in nature. Okay, so it will inhibit the synthesis of mitotic spindles. The other mode of action of these natural products is, they can cause DNA strand breaks. DNA strand breaks by inhibiting enzymes required for sealing these breaks like topoisomerase 1, 2. Example, etoposide, irinotecan, and doxorubicin. Yeah. Some of these plant products, they can cause DNA strand breaks by inhibiting the enzymes which are required for DNA synthesis like topoisomerase 1 and 2, and because of this the DNA synthesis will not take place. So these drugs are like your etoposide, irinotecan, and doxorubicin. Some of the miscellaneous agents are your platinum complexes, cisplatin, carboplatin, which we have, hydrazine derivatives, your procarbazine, then mitoxantron and hydroxyurea. We have hydroxyurea also. So these are not classified under any category. These are the miscellaneous agents. So their mode of action is they bind to DNA and form strands to DNA base pairs and thus cross-link them. The resulting complex formed is a DNA adapter. Use DNA structure. Example, platinum. So basically, these miscellaneous drugs, they will form a bridge between the two DNA base pairs and cross-link themselves, and the new DNA adapt or the new combination which will be formed, that is not correct. So thus produce DNA structural damage. It will cause DNA structural damage, and this in turn will lead to cell death. Just 1 second. Hello. You all can take a break for 10 minutes. I have a urgent mail to be done to my MD. I'll just try to finish it into 10 minutes. Okay. Just give me 10 minutes. Okay.
Okay.
Yeah.
Okay.
Just
Okay.
just 10. Yeah. 10 minutes. Thank you. Thank you. Thank you.